taking action, getting results. You are watching WHNT News 19 at 6:30.
I felt like, given the circumstances and of being pretty much effectively forced to participate in it, that I needed to explain myself to my constituents.
Albertville City Council member Nathan Broadhurst voted against allowing council members to be on the city health care plan.
He said he wouldn't enroll, but is involuntarily being put on the plan in January. Broadhurst for himself first brought this to our attention and told WHNT News 19's Robert Richardson he hopes he can change the system.
That's tonight's top story at 6:30.
The Albertville City Council voted earlier this year to provide health insurance to council members. Part-time employees are not eligible for city health care, and Councilman Nathan Broadhurst considers the council a part-time job.
If you participate, then it shows that you're taking advantage of being a council member. You're taking advantage of the taxpayers and subsidizing your health insurance costs with their money. And I've got a problem with that.
Broadhurst was the only vote against it and the only council member re-elected. In his campaign, he said he would not choose to accept the city health plan.
I'm not reneging on it. If there was any other way for me to avoid this, I would be doing that.
Broadhurst has always had a private individual plan through Blue Cross, but in October his wife became a full-time employee of the city of Guntersville, so he's currently on her family plan. That changes in January when the Albertville Council joins the local government health insurance plan, LGHIP.
You cannot cover a wife, husband, or other dependent if they are covered or eligible for coverage under another unit's LGHIP plan. So that's where that rule kicks in and doesn't allow me to participate in hers.
They would have to have separate plans even if she were an Albertville employee. Broadhurst could get out of the city plan if he were covered by a company group plan, but he doesn't have one as he's self-employed. It's the city plan or nothing, but he's asking the state legislature to change the rule or the city to change its provider.
It just shows you what happens when you put health insurance company lobbyists and bureaucrats in Montgomery in the same room and they come up with rules that aren't beneficial necessarily to cities and employees.
In Albertville, Robert Richardson, WHNT News 19.
The city of Albertville will spend about $5,000 a year to insure Broadhurst while he pays $520. He says he would prefer to pay more to self-insure and save the city that money. Lee?